Welcome to Mr. Chalk's Revision Tips. In this video, we will look at issues, smoking and alcohol. So, risk factors are attributes or characteristics or exposures that increase the likelihood of a person developing a disease or a disorder. So, diet and lifestyle can increase the risk of developing certain types of cancer, for instance. So smoking increases the risk of lung cancer. Using sunscreen can reduce the risk of skin cancer, and eating more fruit and veg will reduce the risk of certain bowel cancers. Blood vessels called coronary arteries supply blood to the heart and muscles. They can become blocked, and if this happens, you can have a heart attack. So some risk factors that would be associated with that would be smoking, high blood pressure, high salt levels in the diet, and high levels of saturated fat in the diet. Diabetes is a disorder in which blood glucose levels remain too high. However, it can be treated by injecting insulin. So type 2 diabetes is caused by a person becoming resistant to insulin. It can be controlled by diet and exercise. So there is a link between rising levels of obesity and an increase in levels of type 2 diabetes. Alcohol-related liver diseases related to drinking too much alcohol. So drinking a large amount of alcohol in a short time can cause fatty liver disease and, less commonly, alcoholic hepatitis. So drinking more regularly than the recommended limits of alcohol over many years can cause liver cirrhosis. Certain behaviour can increase your risk of catching things like HIV and other sexually transmitted disease. So having unprotected sex, having many sexual partners, having sex with a person who is taking drugs where they've used syringes and needles that have been shared between lots of different people can all increase the risk of developing HIV or catching HIV. So smoking causes cancer, heart disease, stroke, lung disease, diabetes and a range of other things. So for mothers who smoke during pregnancy, so smoking increases the risk of miscarriage. So the babies and children are more likely to suffer from respiratory infections and have an increased risk of developing asthma. So long-term physical growth and intellectual development can also be affected. And there is an increased risk of birth defects, as well as the birth weight of the baby being reduced. Emphysema can be caused by smoking. So emphysema causes the walls of the air sacs in the lungs to break down. So we're looking at it to explain how this will affect the diffusion of gases into and out of the lungs. The key things that you need to talk about is that there's going to be less diffusion because we are reducing, or there is a small surface area. So tobacco is a legal drug. So pregnant women are strongly advised not to smoke. So explain how the fetus will be affected. Like we've just said, three of the key things that you would need to mention is that there's going to be a reduced birth mass. The smoke contains carbon monoxide, which means that less oxygen is going to be able to get to the fetus, which can cause issues. Over time, excessive alcohol can lead to development of chronic diseases and serious problems, including heart pressure problems, heart disease, stroke, liver disease, digestive problems. It can increase the risk of cancer, an entire range of things. So, some things that can be associated with alcohol is that a patient begins by feeling sick and experience weight loss or a loss of appetite. If there's a yellowing of the eyes and skin and so forth, that can all be good indicators of liver damage caused by alcohol. So alcohol causes fats to build up in the liver, causing fatty liver disease. Alcohol damage leads to alcoholic hepatitis, which can lead to death. And cirrhosis of the liver can develop, so the liver becomes scarred and loses its ability to function. And changes in the brain can also be caused by alcohol over time. So alcohol can either have short-term effects or long-term effects. So alcohol affects the brain in several ways. So it slows reaction time, it causes difficulty walking, it can impair memory, cause slurred speech, and causes changes in sleep patterns and mood, including increased anxiety and depression. So longer term effects of excessive drinking, it can cause brain shrinkage, it can lead to long-term memory problem, it can cause a range of psychiatric problems, and it may lead to the patient requiring long-term care. Type 2 diabetes is a common condition that is caused by a person having too much glucose for a prolonged period of time. So it can cause symptoms like excessive thirst, needing the toilet a lot, and tiredness. It can also increase the risk of developing problems with eyes, heart, and nerves. So the way that type 2 diabetes kind of develops, so the body fat also affects the body's ability to use insulin. So type 2 diabetes is where the body's cells lose their sensitivity to insulin, so they no longer respond or respond less effectively to the insulin that is produced. So obesity accounts for about 80 to 85% of the risk of type 2 diabetes. So rising obesity is linked with a Western diet, so a diet that includes energy-rich fast foods and an inactive lifestyle.
Thanks for watching.